The 2019-20 flu season was supposed to be the worst in recent history. Just after New Year's Day, Anthony Fauci, director of the National Institute of Allergies and Infectious Diseases, told CNN that this year's flu season was on track to be as severe as the 2017-18 season, which was the deadliest in at least a decade. Fauci told CNN, quote, "The initial indicators indicate this is not going to be a good season. This is going to be a bad season." These predictions were based on the common seasonal flu, not the novel COVID-19 coronavirus, which was only a dim blip on the health radar when Fauci gave this prediction. In a February 21, 2020 U.S. News & World Report story, Dr. Pritish Tosh, an infectious disease specialist with the Mayo Clinic in Rochester, Minnesota, said, quote, "There is a deadly respiratory virus that is circulating throughout the United States, and it's at its peak. It is not novel coronavirus." In a report on Outbreak Observatory composed by the Johns Hopkins Center for Health Security on January 9, 2020, Alina Martin reported how this year's flu season started earlier than usual. According to the report, quote, "Between October 1st to December 28, 2019, the U.S. CDC estimates there were at least 6.4 million people sick with the flu, resulting in approximately 55,000 hospitalizations and 2,900 deaths." This reporter recently modeled a M10M biological chemical mask at a local grocery store. If the COVID-19 coronavirus was in fact as deadly as the media and governments want us to believe, a mask like this is what should have been worn by people in public, not the flimsy paper disposable and homemade bandana masks mandated by the government. At this point, COVID-19 is being found to have just a slightly higher case fatality rate than seasonal flu, for which face masks have historically never been mandated society-wide or entire economies shut down by government edict. That this year's regular flu season was higher is supported by numbers from around the country. Here, in Maine, according to the Maine CDC, the total reported caseload for seasonal flu through May 14, 2020, was 10,206 cases. Meanwhile, COVID-19 cases were nearly a tenth of that, registering only 1,405 cases over the same time period. New cases of seasonal flu in Maine dropped to 0 6 weeks earlier than normal, coinciding with the state's mandatory shutdown and mainstream media's incessant fear-mongering on the virus. Hospitalizations for seasonal flu fluctuated for the first 3 months before caving into 0 at the same time as the state shutdown, since nobody was going to the hospital out of fear of catching the dreaded coronavirus. However, as the Maine CDC began publishing data on hospitalized COVID patients, the weekly trends were consistent with the regular seasonal flu numbers. These stories and more in the print edition of the Fort Fairfield Journal. For WFFJ-TV, I'm Dave Deshan.